Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hi guys, my name is Brillyana Artamevia. I am a FIK Unit Sula student. Well, I'm here to present about international journal analysis, and the time needed is approximately 10 minutes. Okay. Title of the journal: Phenomenology Study is HIV transgender patient experience to fulfill spiritual need. And PICO: P patient, I intervention, C comparison, and O outcome. P patient. This study involved 12 transvestite participants who had been hospitalized because of HIV positive. And I intervention: one, spiritual according to HIV patient transvestite means belief in the existence of God. 2. Be grateful for the coincidence they have. 3. Get closer to God by doing good things. And C. Comparison: get closer to God. And O. Outcome: to explore the experience to transgender HIV patient when hospitalized in fulfilling spiritual needs. Okay, how was the problem identified and formulated? The high prevalence of HIV in transgenders required treatment and treatment service. And what was the objective of the study? The study to explore the experience of transgender HIV patients when hospitalized in fulfilling spiritual need. And what was the hypothesis of the study? This study involved 12 transvestite participants who had been hospitalized because of HIV positive. And formulated clinical question of the study. Research instrument: 1. Researchers, 2. Voice recorder, 3. Structured interview guide, 4. Researcher notes, and 5. Filed notes. And 6. What was or were study designs used by the research method with qualitative design phenomenology study approach. And when and where sorry guys when and where was the study conducted? This research was recruitment participants in December 2017 to September 2018 in one hospital in Sidoarjo Regency. How were the setting and subject determined? How was the sample drawn? Retrieving data using in-depth interview, data analysis using collaging. Okay, what types of instrument were used in the study? Research instrument: 1. Researchers, 2. Voice recorder, 3. Structured interview guide, 4. Research note, and 5. Filed note. Mention the inclusion and exclusion criteria of the patient. Inclusion criteria: 1. Transgender. Information about the identity of the transgender was obtained from the head of the organization that oversees transgender at the research site and based on self-reported as transgender. 2. Having been hospitalized because of HIV positive or HIV was coupled with medical record data or misdiagnosis. And exclusion criteria: 1. Participants are not transsexual who have undergone sex change surgery. 2. Not transvestite which perform cross-dressing for sexual satisfaction. And the last 3. Not intersex genetic disorders that have both sex. And then, how was the study procedure conducted? Research studies are needed that can explore this experience, namely with phenomenological research. How was the data gathered? Who gathered the data? Retrieving data using in-depth interview, data analysis using collaging. What technique of analysis was or were used by the research? The research with interview techniques. What was or were the result like? Okay. Time 1. Spiritual according to HIV patient transgender means belief in God's existence. Taking this stance come from 2 categories, namely having confidence in God and relationship with the Creator. Time 2. Be grateful for the condition of they have. The description that transgender women who are HIV positive feel grateful because there is an opportunity improve life after the diagnosis of HIV. Time 3. Get closer to God by doing good things. The third time comes from the category realizing mistakes and expectation for forgiveness. Third time of worship and effort to do God deeds. And what was or were the strengths and weakness of the study? The reason is due to a lack of accurate data collection for transgender women or transgender men. Was or were there any side effects of the study? If there was or were, explain them. Okay. There is a side effect of this study is that it can reduce HIV patient. Okay. And last, what was the conclusion of the study? Nursing properties support the fulfillment of spiritual need in nursing practice, and in this case, nursing is a profession that is capable of spiritual care. There is always room or opportunity for nurse to provide spiritual service. So, nurse in terms of talking about spiritual, it's the same as when nurse talk about other things professionally, but in reality, this has not been done by nurse. So the expectation is nurse beside conducting biological or physical assessment of the patient, the social condition of the patient, but also conducting spiritual studies. The result of this study how that spiritual is important for HIV positive transgender, because spiritual is inherent in everyone, so that everyone is a spiritual being. Involving spiritual needs, transvestites believe in the existence of God. Transvestites also realize that their existence is still opposed by religion and society. But transvestites express their feeling of gratitude. Uh, but transvestites express their feeling of gratitude for the condition they have. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.